I've been working as a doctor since nearly 40 years and as a cardiac surgeon for about 30 years. The one which I enjoy most is training and teaching young surgeons in cardiac surgery. If you look at the actual figures in terms of the carbon footprint, and we have developed our own medical related software for use by patients, hospitals, doctors and nurses. For example, in building our software products, we doctors have always worked along with the engineers in the product development and testing.
Hello, ladies and gentlemen. Welcome to the esteemed FaceTime with Leaders, an initiative by World Development Corporation. I'm Sunny Pancholi, anchor at World Development Corporation. FaceTime with Leaders is a platform for industry titans to share their experiences, thoughts, ideas, and best practices in order to inspire one another and future leaders. We have one such domain expert and veteran on FaceTime with Leaders with us today, Dr. Julius Punnen. He is a senior consultant cardiac surgeon and group lead for heart and lung transplantation and mechanical circulatory support at the Narayana Institute of Cardiac Sciences in Bengaluru. Welcome to FaceTime with Leaders, Dr. Julius.
Thank you.
So our viewers would like to know in brief about your contribution to the medical field.
I've been working as a doctor since nearly 40 years and as a cardiac surgeon for about 30 years. And have been concentrating on heart and lung transplantation for the last 10 years or so. In the state of Karnataka, I was privileged to set up the first homographed heart valve bank back in 1999. And I also was able to do the first lung transplantation, followed by the first combined heart and lung transplantation about 5 years ago. I have been able to make a whole lot of contributions, but I think these are some of them which I think is important.
All right. So Dr. Julius, which of your roles did you enjoy the most and why?
There are a whole lot of roles that I play, but of which the one which I enjoy most is training and teaching young surgeons in cardiac surgery and in heart and lung transplantation. I had the opportunity to set up and run a cardiac unit within a medical college in Bangalore, where I was the administrative and clinical head of that organization. I was able to set that up and I ran it for about 4 years as part of our own organization's branch. And then I returned to the main hospital. I was also instrumental in setting up a bypass surgery program in association with the government of Assam in Guwahati Medical College. And I helped set up another cardiac surgical program in a hospital in Saudi Arabia as well. So I've been deputed to set up new units in several places over a period of time. And this is something which I've enjoyed doing.
That sounds incredible. So building on to that, what are some values and principles you have lived by in your professional life?
I have been very fortunate that my personal values and principles align very well with that of the organization that I work for, which is Narayana Health. I would live by affordability, access and quality in healthcare while holding up ethical values, to be brief on that.
Okay. So moving on to the subject of ESG and corporate governance, since we have discussed your career journey and your professional pursuits. So is your pursuit in ESG and corporate governance more of the formalization of your long-haul interest in the fields, or did you want to expand your professional purview into them?
ESG is somewhat of a new area in the healthcare industry. One didn't really associate healthcare a lot with ESG, but being a listed company, we've taken on the journey of having ESG compliances, and even before it became mandatory, we have started doing that. If you look at the actual figures in terms of the carbon footprint and pollution, etc., we think healthcare doesn't contribute a lot. But if you look at the statistics, for example, in the National Health Service of UK, it is responsible for about 4% of the national total carbon emissions, and 5% of carbon footprint comes from just anesthetic gases and metered dose inhalers. Globally, healthcare is responsible for consumption of over 9 billion tons of materials and emits 3 billion tons of greenhouse gases. So we are not really exempt from being an industry which contributes less to pollution. We also contribute a lot. So it is time that we all opened our eyes and started looking at various ways of reducing these. And also, healthcare waste forms a large part of the waste which is generated in this, and biological waste and good practices in dealing with healthcare waste is very important. And another area which is very important in terms of ecology and economy are the consumption of single-use devices. Many of these single-use devices are made single-use for the benefit of industry and the manufacturers. Many of them are durable devices which can be re-sterilized and used. And just because they have not applied for a license for multiple use, it is not there. And one is required to dispose of a whole lot of expensive things because that's how it is licensed. So these are areas which are open to change and which can really improve the environmental friendliness of healthcare organizations. I've been fortunate that I work for an organization which is socially very responsible, and we have done a whole lot of outreach programs and bring about healthcare to people who are not able to afford it as much. And our chairman's vision has been to dissociate healthcare access from affluence.
All right. So as an ESG and corporate governance expert, Dr. Julius, what values do you bring to the table?
I will always remain a surgeon first, whatever else I do. But as a surgeon, you can influence the life of one person at a time. You cannot influence more than that at any given time, because you can perform only one operation at any given time. But as a policymaker, as an administrator, you can touch the lives of so many more people and help many others at the same time. And it is important that doctors also take part in the administration of organizations, and thereby we can uphold the professional values in addition to the financial goals of an organization.
So moving forward, let's discuss technology. All right. So what changes do you expect to see with the advent of IoT, AI, ML, blockchain, digital twin, cloud, big data, Web 3.0 in the medical field? That is part of the question. And how do you envisage the growth in the medical sector with these technologies combined with a good corporate governance framework?
Penetration of IT into healthcare industry happened very late, and still there is a long way to go. In the financial sector or in the airline industry, if the IT systems are down, they will be completely paralyzed. But in healthcare, it would only result in some inconvenience, but does not affect the core functioning to a point of paralysis. As an organization, we have our own IT vertical, and I was fortunate to be involved with it as well, right from an early stage. We have developed our own medical-related software for use by patients, hospitals, doctors, and nurses. We are in the process of integrating the monitors with the software to read and store data directly from the machines. And you can apply artificial intelligence and also come up with predictive algorithms to improve acute care. Based on data, adverse events should be predictable and should never come as a surprise in a hospital setting or even otherwise. IoT can enable distant monitoring of patients and prevent catastrophes. You can make a lot of difference to the healthcare industry and the way we deliver healthcare today by having much better application of IT in the various areas.
All right. Okay. So first of all, thank you so much for sharing such amazing insights into different subjects, Dr. Julius. And this brings us to the last question of the session. So we are building a community of industry magnates. The move is meant for cross-pollination of knowledge, and building a knowledge-sharing community of corporate giants and industry experts. So what are your thoughts about these initiatives taken by Mr. Zishan Pathan, Mr. Heval Mehta, and the whole team of World Development Corporation?
I think it is a great initiative. Domain knowledge is the key to good administration in any area. Now, the margins between industries are becoming really blurred. So having people from different industries sit across a platform and be able to share ideas becomes really, really important. For example, in building our software products, we doctors have always worked along with the engineers in the product development and testing. So that is the reason we have been able to develop our healthcare software, which is amazingly user-friendly compared to many of the other legacy systems which are there in this area. When we get visitors from the US, for example, they look at our software and compare it with what is available with them. And they're just amazed at how this functions and how cost-effective this is and how friendly it is with the user. So that is one example how collaboration between various unrelated industries can help in coming up with great products. Thank you.
Great. It was fantastic conversing with you, and I'm confident that your insights will inspire future leaders. Thank you, Mr. Julius Punnen, for joining us today. Wish you the best for your future endeavors. Moreover, trust that this initiative by Directors Institute has unquestionably expanded the participants' understanding and enriched their minds.
Thank you. Thank you very much for having me.
Thank you, and have a nice day.
You too.